it as a scary table. There, she's going to be talking to you one-on-one. And she might be at that point have taken the scenario down because you are not allowed to download the scenario. So if they have taken the scenario off the screen so that they could see you and talk to you, say, I'm ready for my second check. Could you put the scenario back up? Because you literally cannot do a check unless you can see the mark, correct? So you want to ask. That's important that you ask for that. You don't just say, I do my second check. You say, can you put the MAR up so I can do my second check? So then you tell her, I have Mrs. Augustine Bunny. Ms. Augustine Bunny was admitted with a diagnosis of urolithiasis with possible UTI. She has an IV infusing normal saline with 20 kcl per liter at 125 per hour. She has pain of 8 out of 10. She's NPO. And I'm going to give the meds and do an in and out cath on her. Her vital signs, she has a temp of 100. Everything's normal. Her respirations are 14. Her blood pressure's a little elevated, and I'm attributing of 140 over 90. I'm going to attribute that to what?
Pain.
Nerves? Pain.
Pain.
Yeah, she's in pain. So I will, when I come back to reassess her pain, I'm going to reassess that blood pressure. Because if something's abnormal, you have to figure out you have to do something about it, or you have to figure out how to make it better. So we're hoping that two things. One, the morphine's going to lower her blood pressure a little bit. And two, because she has no history of hypertension. So we're going to go with the fact that she's in pain right now. But we're going to reassess that. And so then that is your history on the patient. So for her, I have morphine, 4 milligrams. The last time it was given was 3 a.m. It's now 9 a.m. It's safe to give it. It's given every 4 hours. It's 8 milligrams per ml. I'm giving 0.5. It's a safe dose. I'm going to have to dilute this because she has a central line and I need to put it in a 10 ml syringe. This is all narrative. We're not doing anything. We're all narrative on that. So I'm going to dilute it with 4 mLs of saline. So I would waste my 4 mLs or I would draw up my saline if I'm at sea. It doesn't matter which way you tell them you're going to do it. They are fine with it. And I'm going to then draw up my 0.5 and put it in the syringe. You can do that for them. It takes a little bit longer. If you have the time, you can do that for them if you have those things available to you at your house. Then you say, and I have made my label and I'm going to put my label on it. My label says IV push. I have to give it over 4 to 5 minutes. I have checked the blood pressure. It's okay. It's a little bit elevated. Our respiratory rate is 14. So I have flushes to also do that. I'm also giving Cipro today. So I'm giving Cipro because of a possible UTI. She has not received this before, so I'm going to check her for hypersensitivity while it's infusing. 400 milligrams is a safe dose. It's piggyback. I'm going to also caution Miss Bunny that she could have some tendon issues with this, or she could have diarrhea with this, and she needs to let me know. The IV is compatible. The IV piggyback is compatible with the normal saline, and it's also compatible with the KCL that's hanging. It is the book says it's to infuse over 1 hour. It's in 100 milliliters, so I'm going to set my pump in 100 milliliters per hour. I have completed my second check. And she says, very good, thank you very much, Glenda. So now the next thing you're going to do is you're going to say, and this is where I think the bunny comes in or the patient comes in. Because to me, this is where the narrative part gets hard. So you're going to say, knock, 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 open the door, go in, close the door for privacy, hand hygiene. Hi, Miss Bunny, how are you? I'm here to give you some medicine today. You're in pain? Okay. Can you tell me your name and date of birth? Could you please put the MAR back up so I can compare that? So she puts the MAR back up and you say, okay, I'm checking. It says Augustine Rabbit, and your date of birth matches, and your MR number is 1234. Yes. Do you have any allergies? And she says no, she doesn't have any allergies. And so then you say, okay, I'm raising my bed to working height, and I'm going to do my third check now of my medicines. So you check and you say, I have morphine. I'm giving it IV push, 4 milligrams. Miss Bunny, can you tell me a little bit about your pain? It's 8 out of 10. Where is it located? And can you describe it for me? Okay, we're going to give you something in your central line now, and that will help you get better. So you say it's been over 4 hours since she got it before, and then you say I'm going to give her Cipro. Now the question comes in when we get this, and you hold the Cipro up, and you've got your piggyback tubing, you've got it labeled, and you got it clamped down so it's ready to go. When you're talking about the Cipro, you tell Miss Bunny, you tell the instructor that it's 400 milligrams, it's IV Q12, it's due at 0900 for the first time, it's in 100 mLs, and we'll set the pump at 100 milliliters per hour. Miss Bunny, this medicine might cause you to have some problems with your tendons, so make sure if you have any pain in your joints, or especially in your shoulders or your calves, lift it up. We're holding your metformin today because you are in PO, and the Lipitor is due tonight. And so I have completed my third check. Okay, so now what we need to talk about here, which we didn't talk about earlier, is order. What order are you doing this? Are you doing both the meds and then the cath, or what's the order? What's first?
Morphine.
Morphine. I give the morphine first myself. What's next?
Cipro.
I disagree. Why am I disagreeing?
You would want to do the cath before, since we just gave the morphine. That way the morphine kicks in.
No.
Well,
No. Up here. Look up here. See what I just circled? Give that Cipro before you do the CNS, it will impact. So, you want to give the morphine, do the in and out, and get the culture, and then do the IV piggyback. Everybody got that?
yeah. Thank you.
Yeah. So it changes the order a little bit. Ordinarily, I'd give my meds and get them out of the way, and then do the skill, because that's the easy way to do it. That's not the way. That's not the way. This little piece of information, although it's small, this little thing up here is what drives this whole thing of what you're doing. And so you have to be careful about it. Take a pencil, or take a pen, or take a highlighter, highlight the things, or write it down, put it, underline it, circle it like I'm doing. That's why I love this whiteboard. I mean, it's a pain in the butt to write on, but look how much information we've done, and look what we've done with just crossing out things, and how much we've been able to figure out just from this. And we've just written all over it like it's a scratch piece of paper. So, you're the only one that can hear? Yes. Somebody answer here. Yes, you are the only one. I hope. So, yes. So that's how we do it. We do it in that order. That's exactly. Yes, Melissa.
Hey, it's Jane. Just to clarify, you said to do the morphine first, then the CNS, and then the Cipro?
Then, yes.
Oh.
Because you're doing a culturing sensitivity, and the antibiotic will impact your culture if you give the antibiotic before you do the culture.
Right, but we can do the morphine first and then do it, right?
Yeah.
Okay, I just want to make sure I
I'm
heard you
not
right.
recording. I never record the open labs.
All right, thanks.
I think I get better participation so I don't record them. Morphine first, then the cath with the culture, and then the IV piggyback. That's right. That's exactly right. So, I'm giving the morphine now. I've checked the respirations. They're greater than what?
8,
12.
12.
12. So make sure you know your limits there. Okay. So this is where this also gets to be tricky. Okay? And if you want to use the bunny, this will help you a little bit to do that. I put on gloves and I clean the port for 15 seconds and I put the syringe on, I pull back. So you got to do all of this. This is narrative, but you got to tell them, because now they can't even see you do it. So not only can they not read your mind, they can't see you do it when it's a narrative. So you say, I clean the port and I put this on, I would unclamp it and I would push pause. The full 10 ml syringe, because she's dry, so we're not going to hurt her. I'd clamp it, take it off. I'm going to clean the board again. And my medicine, I'm going to get another one here for the medicine. Clean my port. And I'm going to give the medicine slow push over 4 to 5 minutes. Finish that. Clean the port. Got a new one. Got a new syringe. Clean the port for 15 seconds. Put the flush on for the morphine. I'm going to give this at the rate of the medicine for 1 minute, 3 mLs. And then I'm going to push pause the rest. Questions about that? Jasmine?
Are we just going to verbalize this to them, or are we going to have to demonstrate it?
Narrative. It's a narrative. I think you can use a patient if you want. You have to clarify that with your instructor. And it will, in some cases, help you, and in other areas, it's not necessary. But, yes, Jasmine?
That was from earlier.
Okay. All right. So, I've given the morphine. Is that feeling better? Okay. So then I'm going to say, I would put on, take my non-sterile gloves and just leave them on, and I would do peri-care for my patient. She is going to get the in and out cath. I put my catheter kit down. I'm going to open it away, side to side, and towards me. And then I'm going to turn it, and I'm going to lay that drape and to put it on top of there. And I'm going to, oh, excuse me, I should have taken my gloves off after I did peri-care and did hand hygiene. So that's my self-correct. So then I'm going to put my gloves on, my sterile gloves on, touching the non-sterile part when I put my first glove on, and then sterile to put my second glove on, going inside the cuff to do that. And then just make your hands do it. Don't sit on your hands, which is what this is kind of like. Okay, do I sit on my hands? Use your hands when you're doing this narrative. You know, okay, I'm going to pick up my glove and put it on, sterile to sterile. And then I'm going to adjust my kit the way I need to, lubricate my catheter 2 to 3 inches, and then I'm going to be ready. I contaminated one hand, opened the labia, I cleaned the far side, brought it back towards me, put it in the, I pick up the next swab, near labia, towards me, and down the center, towards me, and do away with it. Pick up the catheter, put it in, urine starts coming out, put it in the sterile container first, then move that away and let it continue to drain. And when no more urine is coming out, then I'm going to tell my patient to take a deep breath and hold it, and I'm going to put that in my glove, wrap it up in my gloves, discard it. I'm going to then measure the urine, and I'm going to record the color, consistency, and amount of the urine. I'll label my specimen with my patient's name, MR number, and put it in the biohazard bag. So after I put it in the biohazard bag, I will then do hand hygiene, and I will put my patient down, raise the rails up, give him his call light, ask him to say, Mr. Bunny, do you need anything? Is this good, Miss Bunny? Is this a good position? Yes. Okay. Do you have all your possessions? Okay. How's your pain level now? It's been about 15 minutes. Okay, and I'm gonna reassess your blood pressure now. Your blood pressure's down to 120/70. That's good. So it was pain. Okay. And is there anything else I can do for you before I go? Pain, body, possessions, position. Okay. And here's your call light if you need anything. Rails down. I'm in bed down. Rails down. Out. Hand hygiene. I'm going to document the size of the catheter that I use, sterile technique, the color, consistency, odor, and amount of the urine, and how the patient tolerated it. I'm going to document the reassessed value of the pain, which is down to a 5, and the reassessed of the blood pressure. And that's it. We're done.